So, hi everyone. So, last class we have discussed the Ayurveda part of Kaumarabhritya, and also some parts of Kashyapa Samhita is also discussed. So today we are going to discuss the Indriya Sthana of the Kashyapa Samhita. So here the two type of chikitsa is described, and one is Aushadha and other is Beshadha. And also 10 sopna, different type of sopnas are described. It is divided into two, that is Nishphala Sopna, which is in 10 in number, and Phaladayi Sopna, which is in 6 in number. So you have to remember this number. Two types Sopna, Nishphala and Phaladayi. Okay. And next, the Siddhisthana. Here you have to study the Vasti Guna. Vasti karma kale balanam amrudobama. So according to Kashyapacharya, the Vasti karma is equal to nectar for bala. Okay. And the next is Trilakshana Siddhi Adhyayam. Here two type of nasya is described. That is Brahmana nasya, which is mainly used to mitigate the Vada dosha. Vada pradhana rogam mein sneha maduradi aushadha siddha nasya is described. Whereas the second one, that is the Karshana nasya, which is used in Kabha pradhana roga. Okay, so Ruksha Kadu Aushadha are mainly used here. Right. And coming to the next point. Nasya Karmiya Siddhi Adhyayam. There are also in this chapter two type of Nasya Karma is explained, that is Shodhana and Purana. And also the Jala Peen ke baad Nasya karne se Nasa Srav Shiro Rog Sharir ka Baripan hota hai. So these are the symptoms which produced after drinking cold water after Nasya. Okay, the complications. And what happens if Nasya is given to Rajaswala? Ridu Vyabat is the complications that are going to occur. And the Snana Paschad Nasya Dene se Yoni Ubashushari. So after Snana, if Nasya is given, then the Yoni Shushya is happening. Okay. And the treatment given for the Nasya Vyabat is Kumara Taila, Yeshtimati Taila, Punarnava Taila, Purana Gruda. And these all can be used as Nasya, Pana and Abhyanga. So it is the treatment given for Nasya Vyapat. And स्तनपान करने वाले बालक में नस्यार्थ कड़ु तैल अथवा सैंधव युक्त घृत 2 से 3 बूंद का उपयोग करें. So the baby who is taking the milk, he can give the kadutaila and saindava yukta gruda. These two can be given or used as a purpose of nasya. Okay, 2 to 3 drops of this taila or this gruda can be used. Then next, the important point that is comes in the Mangala Siddhi Adhyayam. Here, the Kashyapacharya mentions Shaishuga Sneham. The importance of Shaishuga Sneha is that it is used for the Vasti Karma. So, Shaishuga Nama Sneho, Vasti Karmani Shasside, Balanam Sarva Rogagno Nirdishtaha Pushya Karma. So, it is helps to mitigate the all diseases that are produced in children's. Okay. So, the Vasti Karma ke liye Shaishuga Sneh Prayog. Okay. And for Vadika Dosha diseases, Ardha Tailiga Niruha is mentioned in Kashyapa Samhita. And also in Sarva Dosha ke liye Katranadiga Niruha is mentioned. So just remember these names of the Niruhavasti and the Shaishuka Sneha and its indications. Okay. Then moving to the Kalpasthana. Here, the first one is Duba Kalpadhyayam. The Kumara Duba, different type of Dubas are mentioned here. And the Kumara Duba is mainly Balagonki Vriddhi Hedu. It is used for Vriddhi. The growth of this baby, the Kumara Duba is helpful. And in Maheshwara Duba, it is helpful in Grahabaha. So we have discussed different type of Grahabada. So in all Grahabadas, we can use Maheshwara Duba. And he also mentioned Dashanga Duba in case of Abasmara and Visheshadaha Graharoga. Abasmara, we can use Dashanga Duba. Okay, and if, there are a lot of Dubas are mentioned. And Pradiduba, you can see here Pradiduba, which is used in Sarvaroga. Okay. And here the Kashyabajara mentioned the Leshuna Matra. Leshuna Matra in Hina Matra for intake of the Leshuna is 4 Pala. In the case of Ardra Rasona, we can take 4 Pala as Hina Matra, whereas 6 Pala as Madhyama Matra, 8 or 10 Pala is the Shreshta Matra for Ardra Rasona. Whereas in case of Shushka Rasona, the Hina Matra is 50 Leshuna and the Madhyama Matra is 60 Leshuna and the Shreshta Matra is 100 Leshuna. Okay. So, Ardra Rasona ke liye 8 or 10 Pala is the Shreshta. Whereas in Shushka Rasona, 100 Leshuna is the Shreshta Matra. Okay. Then, if what is the complication if we take the Shidobajara during the Leshuna Sevana Kala? The complication mainly produced is Jalodhara. So Jalodhara is the main complications if we take the Shidobajara during the Leshuna Sev. Okay. And coming to that Kuladuba Sangya. So we have seen different type of Duba, and totally the Kashyabajari mentioned 40 type of Duba. 40 type of Duba. The number is very important. And 3 type of Duba is mainly explained. That is Duba, Anuduba, Pradiduba. Type of Duba is mainly 3. Okay. And Duba ke Ashray is 2. That is Chavara and Jangama. Animal and non-animal things can be the Ashraya of the Duba. And the Devada for the Duba is Agni. Okay. So Leshuna Kalpadhyayam, we have discussed some points about the Leshuna Matra, the complications of Leshuna, and the first one, that is the Resona Ulpati. Coming to the Ulpati of Resona, अमृत पान के पश्चात इंद्राणी के वमन से रेसोना को उत्पत्ति बताया है. Okay, its synonym is Amrita. Resona ke another name is Samrita. And 2 type of Leshuna is explained in Kashyapa Samhita, Girija and Kshetraja. Whereas the Girija is considered as the Shreshta type of Resona. And coming to the Resadi Panja, the Lesona is Amla Resavarjita. And Swadu Tikta Evam Kadurasa Kramashaha Balava. So in Resona, the Amla Rasa is absent. Okay, this is very important. Resona, Amla Rasa is absent. And its Vibhaga is Madura. Okay, Vibhaga of the Resuna is Madura and it is devoid of Amla Rasa. Then the next chapter, that is Kadutaila Kalpam. This Kadutaila is used for Pliha Nashanam, different type of diseases produced by spleen. So Pliha Nashanam is the indications of Kadutaila, and its Shreshta Matra is 12 pala. Okay. Next is Shadka Adhyayam. Here you can Anupana of the नेत्ररोग में नारी स्तन्य से आश्चोदन करने के लिए बताया है. सो आश्चोदन करने के लिए नारी स्तन में उपयोग करता है. एंड नेत्र रोग में 6 दिन बाद आश्चोदन करें. सो the important thing is breast milk can be used for Ashchodana karma, and also after the 6 days this Ashchodana can be done in Netra Rogas. Okay. And coming to Shadapushpa Shadavari Kalpadhyayam. Here Shadapushpa Kalka Matra Anupan Bede se कहा गया है. That is जडराग्नि वर्धना के लिए मधु, शतपुष्प के साथ मधु can be taken as anupana, and into balavardhanartham taila can be used, and rupa vardhanartham shira and sarpi can be used. Okay, and Prihodara Kadudaila can be used. So we have discussed earlier Kadudaila is Priha Nashanam. So along with the Shadapushpa and Kadudaila can be taken as Anupana in case of Prihodara. Okay. Next, that is Devadi Kalpadhyayam. Here different type of synonyms and different type of Jadaharini is explained. It's very important, and we will learn it in the section of Prasudhi Tantra. So the padyayas of Jadaharini is Revadi, Raudri, Pilipichika, Varuni. These are the synonyms. Okay. And the important point that you have to remember is the Jadaharini Sankhya. Total 35 is the number of Jadaharini mentioned in Kashyapa Samhita. And Jadaharini Akram se Rakshanartham Kameshti Yajna. So, in order to protect from this Jadaharini, the Kameshti Yajna is recommended. Okay. And we have discussed 35, totally 35 Jadaharnis are present, and the Sadhya type of Jadaharni number is 11, whereas 16 type are Yapya and 8 are Asadhya. This is also very important. Mark as 3-star important. Sadhya Jadaharni 11, and Yapya is 16, and Asadhya is 8. Okay, total 35. And Varanabandha, that is गर्भ की स्थिरता हेतु एवं गर्भपात के भय के निवारणार्थम गर्भिणी में 8वें मास से पूर्व वारणबंधम करना चाहिए. So in this type of banding, varanabandham is advised by the Kashyapa Samhita before the 8th month of the pregnancy. Okay. So remember that point also. 8 months is the time recommended for doing Varanabandham. Okay. The next one, that is Bheshja Kalpam. Here, Ahara Sevan Kram indicated, and the first use the Snigdha and Madhura Padartha. So when we take the food, we are recommended to use the Snigdha and Madhura Padartha first, and in the middle, Shida, Dreva and Nana Vyanjana Padartha can be used, and the last Tikshna, Ushna, Duksha and Legu Padartha. So first is Snigdha and Madhura, and the last Tikshna, Ushna, Duksha and Legu Padartha is recommended. Okay. Then coming to the Ikshupana, the Ikshupana in case of Kaba Pragriti persons, it can be taken after the food. Bhojan ke baad, Ikshupana is recommended. And in Vada Pitta Prakriti cases, it can be taken before the food. The Ikshupana is before the food in Vada Pitta Prakriti. And in Samsrishta Dosha, the Bhojan ke Madhyame, middle of the food, we can take the Ikshupana. Okay. And in Tishnagni Purushko, Sadaiva Brahmanam, Mandakni Purushko, Deebanam, Evam, Vishamakni Purushko, Sadadam, Patya Sevan Karai. So, in case of Tishnagni, the treatment we can always adopt is Brahmana treatment, and in Mandakni person we can always adopt Deebana is the treatment we can adopt, and in case of Vishamakni, Patya Sevana is recommended. Okay, using wholesome food is recommended in Vishamakni cases. And the next point, that is Kushike Teen Bag, 1/3 for Pani and 1/3 for Anna, 1/3 for Vadadi Dosha. So it's also important. Okay. Next is Vishesha Kalpadhyayam. So here 13 type of Sannibada हीन मध्य अधिक भेद से किया गया है. सन्निपात ज्वरम 13 type of सन्निपात ज्वरम is mentioned in विशेष कल्पाध्यायम. So these 13 type ज्वर के लिए different name है. Here the त्रिदोषज पुडपागला व्याधि, that is the त्रिदोषज सन्निपात ज्वर के नाम है. So व्याधि महाव्याधि दारुण तथा शीघ्र प्राणनाशक होता है. So त्रिदोषज पुडपागला, it is the name of त्रिदोषज ज्वर mentioned in Kashyapa Samhita, and it is शीघ्र प्राणनाशक. Okay, महाव्याधि, and it is शीघ्र प्राणनाशक and daruna. And coming to the chigilsa of this Sannipada Jara, the Ushnobhajara is recommended here, and also Madhu Nishida. Madhu Shida Hone se Sabi Sannipat Nishise. So Madhu, the honey is called in potency, so it is not recommended in Sannipada Jara. And the Lengana is advised in 3, 5 or 10 days. Adava Arogya Prapti Tak. So the Langana is recommended for 3, 5 or 10 days until the person acquires healthy nature. Okay. Next is we are discussing about the Gilasthana of Kashyapa Samhita. Total 80 chapters are present in Gilasthana. So first one is Vishama Jara Nirdeshi Adhyaya. So here the Vishama Jara means Sandad Jara ka Samavesh nahi kiya hai. So Kashyapa Jara not mentioned the Sandada Jara in the Vishama Jara. Okay. Whereas he mentioned Sadada Jara, 4 type of Vishama Jara is mentioned, and that is Sadada Jaram. Here the sthana of the Sadada Jara is Amashya and Anyedyuga Jaram. Here Uras is the sthana of this Anyedyuga Jaram, and in Tridiyaga Jaram, Kanda is its sthana, and in case of Chadurtaga, Shiras is the sthana. So you have to remember the sthana and the respective Jara. Okay. And also remember the Sandada Jara is not mentioned by Kashyapa Acharya, whereas all other Acharyas are mentioned the Sandada Jara. He mentioned Preda Jara or Grahota Jara. Instead, he mentioned the Preda Jara or Grahota Jara. It's only mentioned in Kashyapa Samhita. Okay. So, the treatment mentioned here, the Ushna Kriya, and also we can give the Mahakalyanaga Sarpi, Panchagavya Grida, and Budeshwara Neelakanda Puja. That is the worship of Lord Shiva, and the intake of different type of Grida is mentioned. The Grida is possible to take after the Amavasta. Okay, so we have to first we have to assess the patient's condition, whether he have any ama or he is in nirama avastha, then only we can recommend the sarpi. Okay. And the second chapter, that is the Vishesha Nirdeshi Adhyayam. Here Samajjar and Niramajjar के लक्षण वर्णन किया है. This Samajjara become the Nirama in nature after 8 days. So according to Kashyapacharya, after 8 days the Samajjara is become Nirama. Then after that 8 days we can give the Pajana Kashaya. So the Pajana Kashaya is recommended after the 8 days where the Samajjara is become Nirama. Okay. And he also mentioned the order of the Jara Chigilsa. The first, that is the Lengana, then Swedana can be adopted, then Dibana, or Dibana can be done with a Paya, and then Odana, teen type of Yusha, and Kashaya, teen dress, and Sarpi, Abhyangam, Vasti, Pradeham, and Avagaha. The last one that mentioned is Avagaha. The first treatment we have to adopt is Lenganam. Okay. And coming to the Baishajobakramaniya, here he mentioned the Dravyamam Dres Pradhanada Shreshta. In case of Madhura Rasmim, Madhuga is the Shreshta, and in case of Amla Rasmim, Kabita is Shresht, Lavana Rasmim, Saindava is Shresht, and Kadu Rasmim, Nagara, and in Tikta Rasamim, Tikta Rohini or Kadurohini, and Kashaya Rasamim Abhaya. So it's very important. Kashaya Rasamim Abhaya, Levan Rasamim Saindava, and Amra Rasamim Kabita. So note these 3 points. Okay. And he also mentioned Saptavida Kashaya Kalpana. According to Kashaya, the Kashaya Kalpanas are 7. Whereas other acharyas mentioned 5 type of Panjavida Kashaya Kalpanas, whereas in Kashyapa it is 7 type. What are they? Churna, Shida Kashaya, Saraso, Abhishavastada, Panda, Kalkastada, Kwadi, Yada Vaktam Nibodham. So Churna, Shida Kashaya, Swarasa, Abhishava, Panda, Kalka, Kwada. Okay. You have to remember these names and the type of Kashaya Kalpanas. Okay. It is frequently asking the type, how many type Kashaya Kalpanas are mentioned in Kashyapa Samhita. Okay. And here also he mentioned about 10 type of Aushadha Kalas is mentioned. And next is Yusha Nirdeshi Adhyayam. Different type of Yushas are mentioned in this chapter. And he also explained the famous quote. You can see the Ahar ko Mahabhaishaj kaha hai. Aharohi Mahaushadam. This is the famous quote by Kashyapacharya, which is very relevant in this condition. In this era, it is very, very important because the food that we have taken is the causative factor for the diseases. So, Kashyapacharya ne ये quote ये very, very important है. आहार को महाभैषज कहा है. And also he mentioned आहार को प्राणियों का प्राण कहा है. Both are equal in the meaning. Okay. And he mentioned totally ahara, different type of ahara is mentioned. Samanya Bedumim, Aharana Samanya, Ahara is 1 type. Whereas according to Vidya Beda, it is 2 type. And Shida Ushna. Okay. And Dosha Bedumim, 3 type. And Bhakshya Bhojadi, according to that, it is 4 type. And Panja Bodhigam, 5 type. And Shadrasa Ashramim, 6 type. And Kaladi Bedumim, it is 24. And Pravijarana Bedase, it is 12. Okay. And he also mentioned two type of Yusha Beda here. And Yavagu Dosham. 7 type of Yavagu Dosham and Odana Dosham is also mentioned in this chapter. And totally 21 Yavagu Kashyap ने 21 Yavagu का वर्णन किया है. And दीर्घ उपवास करने वाले व्यक्ति के लिए क्षीरपेय प्रशस्त मानी गई. So after a long period of upavasa, the क्षीरपेय is recommended for those persons. Okay. Then भोजन करने के बाद मुहूर्त भर आराम करके 100 कदम टहलने और सुखपूर्वक अच्छी तरह बैठ जाए. So he mentions that after food he should take 1 muhurta or 48 minutes rest, and then he should take 100 steps. Then only the proper digestion will be taken. So you have to remember the time of rest, that is 1 muhurta, and 100 steps should be taken after the intake of food. प्रभात काल में हुआ अजीर्ण व्यूठाजीर्ण कहलाता है. So it is all 4 types. This vyutajir, this is mentioned only in the Kashyapa Samhita, which is the ajirna produced in the morning time, and it is in 4 types. Okay, just mention that, just remember that name and its type, 4 type. So there is no specific code to remember these points. You have to just read these points. Okay, this is the main points that I have explained in the class, and after the repeating study, you will get these points. Okay, there is no special code for to remember this. Okay, and next, that is Rasa Dosha Vibhagi. So totally here 62 Kalpana. According to Dosha Beda, 62 Kalpana is mentioned, and also Rasam ke Vigalpa Bed means 63 and Rasa Samyog means 57. Okay, and coming to the Samshuddhi Visheshana Adhyayam, here 2 type of Kal, that is Visarga Kala and Adana Kala ke discussion kiya hai. What are the Visarga Kal? Pravat, Sharat and Hemant. And the Shishira, Vasanta, Grishma is coming under the Adana Kala. Okay. Then, in case of Vamana, the Hina Vega के लिए 4 number है. 4 Veg after the Vamana Karma, if it is 4 in Vega, it is known as Hina Vamanam. And if it is Madhya in nature, the 6 Vegas are present. And in Uttama, the 8 Vegas will be there. And according to the Kashayapana, in case of Hina Vamana, it is in quantity of 2 Anjali, and in Madhyama, it is in quantity of 3 Anjali, and in case of Uttama, it is in the quantity of 4 Anjali. Okay. You have to remember the Vega and also the quantity of the Kashayapana. We will discuss in the portion of Panchakarma, that is we are going to study the next class. So the I will provide the specific code for it, okay, at that time. And next is the Gandharva Tailam, which is used known as Shreshta Sneha Virejana. So the Gandharva Taila is known as Shreshta Sneha Virejana according to Kashyapacharya. And Trivurtashtaka Churnam is used for Virejana. The content Trivurt is mainly used for Virejana. Okay. And according to Kashyapacharya, For Matravasti, the Hraswa Matra is 1 Pragunja and the Uttama Matra is 2 Pala. Matravasti ke liye Uttama Matra 2 Pala. Okay. The next important point that is discussed in Raktagulma Vinishchaya. For females, there is 8 Ashiyas. That 8th Ashiya is known as Garbhashya, and Purush ke liye 7 Ashiya hai. And the Kashyapa mentions the Krimi Ashiya, Visheshan Varnan. He mentioned the specific special Ashiya that is named Krimi Ashiya, and he also mentioned the Raktagulma ka Swadandra Varnan. So a special chapter for the Raktagulma is present in Kashyapa Samhita, Gilastana. Okay. So the lection of Raktagulma as Kasa, Shula, Jwara and Adisara. The Chigilsa, the 10 months se पूर्व, it is Yabya. So Garbhakal ke पश्चात it is Sadhya. This is the prognosis of the diseases. Disease of that is Yapya before 10 months, and after the 10 months it is Sadhya. And he also mentioned the Pradhana Vyadhi in Garbhini and in Sudika. In pregnancy and also after the pregnancy period, the important disease mainly produced is Jwara. Okay. And in Jada Karmottara Adhyaya, he mentioned Shodasha Samskara. We have discussed in the last classes different type of samskaras, isn't it? So in first month, Kridaraksho, Homa Mangala, Swastasya Suryodaya Darshana, Pradoshe Chandramasa. So I am not going in detail. We have discussed this. And next is Visarpa Chigilsyadhyayam. Here the Sthana Samshraya is mainly occurring Tvak Rekta Mamsa. In case of Visarpa, the dosha Sthana Samshraya is happening Tvak, Rekta, then Mamsa. Okay. So it is like Ashi Vishatvat. It is like the spreading of Visha. Like that, the Visarpa is spreading throughout the body. Okay. So he mentioned 7 type of Visarpa. Na vina rekta pittabhyam Visarpo jadu jayade. So Rekta and Pitta is mainly involved in the production of Visarpa. Okay. It is very important because in Visarpa, it is spread quickly all over the body like Ashi Vishatvat. So that point is important. Ashi Vishatvat is the Ubama for Visarpa. And in case of Masuriga, Vispoda, Kaksha and Pama, this type of diseases, we can adopt the Visarpa Chigilsa. And these type of, don't go in detail of this Chigilsa. We will discuss it in the Kaya Chigilsa part. Okay. And next, the Kugunaga Chigilsa. Here, the cause for the Kugunaga is Shishuki Mada Dwara Madhura Dravya Sevan. And दिन में भोजन करते ही सो जाना, that is भुक्ता भुक्ता दिवा शेदे विसप्ञा च विबुध्यते, and मादा द्वारा लवणम एवं आम्ल रस सेवनम. So these are the causative factors for Kugunaga, and we have discussed earlier. And the dosha, mainly the Kuguna dosha is Shleshma Lohida Sambhava. Do you remember the code Kugunaga? Anyone? Kugunagara, isn't it? Kugunagara. And remember the Acharyas, that is according to Sushrudacharya, Kugunaga is mentioned in which category, and according to Ashtanga or Vakbadacharya, Kugunaga is mentioned in which category. So it's very important. Okay. And the treatment for the Kugunaga, mainly the Vamana for Dhatri, and Pajana and Stana Nirdohana. And also Panise Shishu Netra Avasejana of the eyes, the cleaning of eyes with water. And Tulasi Patra Rese 3 दिन या 2 दिन तक आश्चोदना. So, Ashchodana is mentioned with the Tulasi Patra Sarasa. Okay. Next one, that is the Amla Pitta Chigilsa Adhyayam. In this chapter, the synonym of Amla Pitta is Shuktagam. And he mentioned 3 types of Amla Pitta, that is Vada Pitta Kaba. And the treatment, the Shrestha Chigilsa for Amla Pitta is Vamana and also Deshandara Gamana. Note that point. Deshandara Gamana is mentioned in which disease? In Amla Pitta. The going from one place to another place is mentioned. That is Deshandara Gamana. It is very important point, Deshandara Gamana, in case of Amla Pitta Chigilsa. Okay. So next is Shodha Chigilsa Adhyayam. Mainly 4 type of shofa is mentioned. And in the treatment section, Trisama Guliga, that is the ingredients are Shundi, Haridagi, Guda, Samana Bhag. These are the ingredients. And Navayasa Loha is mentioned in which context? Shodha Chigilsa. Okay. And Pippali Vardhamana Rasayan is mentioned in Rajayakshma and Shodha Chigilsa. You just remember this name of this yogas. Navayasa Loha. According to Kashyapa, he mentioned in Shodha Chigilsa. And also Pippali Vardhamana Rasayana is mentioned under Rajayakshma and Shodha Chigilsa. So different acharyas, according to the Ashtanga Hridaya, I think the Navayasa Loha is explained in Pandu Chigilsa. Okay. And first you study the opinion of Kashyapacharya. Then we will detail study of these yogas. We'll study in the Kaya Chigilsa session. Okay. Next, the chapter is Shira Guna Visheshya Adhyayam. Here, 8 type of Shira is explained, and which is the best Shrestha Shira, Gavam Shira. So, Gavam Shira is known as Jivana. Okay. And also, the next chapter, Paniya Guna Visheshya Adhyayam. He mentioned 4 type of Andariksha Jalam, and in pregnancy time, it is contraindicated to take the cold water. Okay. And also the Hamsodaka Varnan is also mentioned here. The mainly 4 type of Andarisha Jala and contraindication of Shida Jala in pregnancy is mentioned. Next is Shula Chigilsa Adhyayam. Here also he mentioned Deshanga Gridam, where the 10 ingredients are explained. Whereas Deshanga Guliga is mentioned in which context? Anyone? Deshanga Guliga. Deshanga Grida is mentioned in Shula Chigilsa Adhyayam of Kashyapa Samhita. Okay. Whereas the Deshanga Guliga is mentioned in Agada Tantra in Ashtanga Hridaya. Okay. You will study when the Agada will. Next is Ashtajara Chigilsa Adhyayam. He mentioned the Lakshadi Thailam, which is Vada Kaba Jwara Nashagam. So in the last class, we have discussed the ingredients and its Falashuddhi of the Lakshadi Thaila. Okay. According to Kashyapacharya, it is Vada Kaba Jwara Nashagam. And it is a Shrestha Thaila for all diseases of the children's, Lakshadi Thaila. It is Brahmana in nature. And next chapter is Mamsa Guna Visheshya Adhyayam. In this chapter, The mamsam is the qualities of the mamsam is vrishyam, balyam, and prana vivardhana. And mamsam pushtigaram vriddha krishana mamsavardhana. So it helps to increase the muscles or mamsa of the vriddha and krisha, and it is pushtigara, and increase the prana vivardhana, and it is vrisha in nature. So these are the qualities of the mamsam. So for Shayi and Sheena Dehi, Vandya. So in these three persons, we can say that the Mamsra is the Shreshta Drivya. In case of emaciation, and if the person have chronic fatigue, and in case of infertility, so the Mamsa can be taken as a Shreshta Drivya. This is the opinion of Kashyapa Samhita only. Okay. And he also mentioned the Garbhavastha evam prasavakal donom sidyo mein mamsirat parama aushad bataye. So in case of Garbhavastha in pregnancy time and after the delivery also, the mamsa rasa is the parama aushada. Note that point. Mamsa rasa is the parama aushada for pregnancy period and in after delivery period. Okay. And the next chapter, that is Madhu Visheshana Adhyayam. Here, the Madhu Guna and Nava evam Sadyakshada Vranka Rohan karta hai. उष्ण पदार्थ के साथ मधु सेवन करने से मृत्यु का कारण बनता है. So he mentioned this when the combination of honey and hot things, if it is mixed with the hot things, that is hot water or anything, it will cause the death, mrityu. Okay. So these are the points you have to remember in the Kashyapa Samhita. We have completed the points in Kashyapa Samhita. And next is we are going to study the modern part, that is the modern pediatrics. This is a vast subject, and we don't have to study the each and every point in this pediatrics. But in this class, I am only mentioning the important points. Okay. Then you can refer the previous year question papers, and then you can add the information. Otherwise, you have to study mainly the Ayurvedic part, and then after you have to study the important point that we have discussed in our class, the modern portions. Okay. And you have to refer the previous year question papers. It is also very, very important. So you have to start preparing from today itself. Okay, you have to study the notes that we have given in the class, and also you have to refer the previous year question papers. That is very important. Then you will have an idea how to write an examination, how will prepare for the entrance examination. Okay. Okay, Dr. Bala. The name of Ajirna, Vyushtajirnam. Vyushtajirnam. Okay. It is foreign type. Okay, 4 types. Any other doubts? Okay. So we are start our modern part. Okay. So first we have to learn the various stages of growth and development of the child. First, that is gross motor changes, growth motor development. So in the 3rd month, the main milestone that the baby achieves is neck holding. So the first milestone that is achieved in 3rd month is neck holding. Okay. Then in 5th month, sitting with the support. The baby is sitting with the support. And in 8th month, he is sitting without support. And in 10th month, walking with the support. And in 11th month, crawling is happen, and in 12th month, standing without support, and in 13th month, walking without support. So these are the milestones, the order of milestone the baby has to be achieved. Okay, and neck holding capacity and sitting without support. These two are indicates the maturation of vertebral column and the adjacent stabilizing structures. Okay, so main thing to understand the maturation of the vertebral column and adjacent stabilizing structure is the neck holding capacity, which achieved in 3rd month, and sitting without support. Okay, and we are assessing these two things by Ubhavesha Samskara. We have discussed in the previous class, what is Ubhavesha Samskara, and different opinion about the Ubhavesha Samskara when it has been done. Okay. So one thing I have to say that while studying, when you see a word that you have studied in earlier portions, then try to remember what are the points you have studied in that point. Okay, in here. So if you say if you see the Ubhavesha Samskara, then try to remember what are the things you have studied in Ubhavesha Samskara, what are the opinion of different acharyas, in which month these samskaras are advised. Okay, and also what are the complications produced due to the Atyubhaveshana. We have discussed these all points. Okay, these things are very important. Then only you can easily recall at the time of examination, right? Next, that is the fine motor development. So in the 1st month, the baby grasps a rattle or a ring when it is placed in his hand. Okay, when you observe a baby, you may see that he grasps the things, that is a ring or something, when it is placed in his hand. Okay, it is achieved in the 4th month. Okay, and in 5th month, he holds the object by both hands. So when a toy is given to his hand, he holds by both hands in 5th month. Okay. So in 7th month, he holding the object with a crude grasp, that from palm to palmar grasp. Okay. In 9th month, what happening? The pincer grasp is present. That means holding the small objects between index finger and thumb. That is pincer grasp in 9 months. So in 9 months always he start to holding the object which is placed on the floor or something. That is the development of pincer grasp. Okay. And coming to the language development, in 1st month he turns the head towards the sound. If we call the baby with his name or something, he turns his head towards the sound. That is the 1st milestone in case of language development. And in 6th month, he tells some monosyllables. He calls his mother ma or something. Monosyllables. Some words he will tell in 6th month. And in 9th month, bisyllables, 2 words. Okay. And in 1 year, 2 words with a meaning. In 1 year, and the meaningful words, which is of 2 words in combination. Okay. And in 2 years of age, he will explain, or a simple sentence will say. And in 3 years, telling a story. So he is capable of telling a story in 3 years. Okay. In 1st month, turning head towards the sound. And in 2nd year, he will say in a sentence. Okay. So these are about the language development. And in case of personal and social development, in 2nd month onwards, he will have a social smile. So when he observe a person who is coming near to him, he will smile. Okay. The social smile is very important, because in case of mental retardation, the baby will not have this type of social smile. And also if he have any type of diseases related to the eyes, that is decreased eyesight or something, he will have delayed in social smile. Okay. And in 3rd month, he recognized his mother, and in 6 months, smiles at the mirror image. Okay. And in 9th month, he waves bye-bye. He will say bye-bye in 9th month. And in 1 year, he plays a small symbol ball game. Okay. These are the personal and social development of the baby. This is the immunization schedule. You are aware of it, and you have to by heart this. And at the birth, the vaccines we are given is BCG and OPV vaccines, and in 6th week, that is DTP1, OPV1, and hepatitis B1 and HIV1. And in 10 weeks, that's DTP2, OPV2, and hepatitis B2 and HIV2. And in 14 weeks, it is DTP3 and OPV3, hepatitis B3 and HIV3. And in 9 to 12 months, the measles vaccine is given. And in 16 to 24 months, and DTPB1 and also OPV4 MMR3 vaccine is given. And in 5 to 6 years, DT4 is given. And in 10 years, TT5. And in 16 years, the TT is given. And the vitamin A can be given 9, 18, 24, 30, and 36 months. And in case of pregnant woman, and early pregnancy, the tetanus vaccine TT1 is given, and in 1 month later, the TT2 is given, and TT booster is given if vaccinated in the past 3 years. Okay. Then next is dosage formula. This is very important. The first, in modern science, the dosage for the different medicines is calculated by using these formulas. Okay. The first, that is Young's formula. The child dose is given as adult dose into age by age plus 12. Okay. And the Cowling's rule, that is the child dose is given as adult dose into age plus 1 by 24. And the next one is Dilling's formula. Here the child dose is calculated with as the adult dose into age divided by 20. So you don't have to by heart these formula, but just I am giving a code for it, and you have to select these options while answering the questions. Okay. So the Young's formula, you can write the code as 12-year young boy. 12 years young boy. While decoding the 12, you can see here the 12 in this formula, and young for Young's formula. Okay, 12-year young boy. And the Cowling rule, please write उसके पास 2-4 cow है. उसके पास 2-4 means 24, 2-4. 2-4 cow hai. Cow means cowling here. Okay. Next is Dilling's formula. Write the code as दिल में 2 बार zero बोला. दिल में Dilling's formula 2 बार 2 and 0. 2 बार 0 बोला. Okay. Got the code? This is an important formula for calculating, and there are also another formula, that is Freud's formula, and another one also present, but these three are very important. Okay. And moving to the next point, that is the examination of the baby at the time of birth. So main thing you have to remember in this portion is the APGAR scoring system. You may have studied this during your BAMS time, and this APGAR scoring that was described by Virginia APGAR. Okay, so this examination is done in the neonate in the first and fifth minute in order to assess the neurological status of the baby. Okay. So in the case of neonatal examination, in Ayurveda part, we have discussed Navajada Shishu Parisha. So in the Sadyojada Parisha, we have discussed the Prana Pratyagamana and other things. So this APGAR scoring system comes under this Prana Pratyagamana. Okay, in order to assess the neurological condition of the baby. So if the score is less than 3 or in the 15 minutes or later, we can infer that the baby has cerebral palsy or CP and the brain damage in 57% cases. So let's study what is this APGAR score. Okay, the A stands here for appearance or the color of the baby, and the scoring is given as 0, 1, 2. If the body color is blue or pale, we are given the score as 0, and it is blue in peripheries. If its upper and lower limbs are blue in color, the score is 1. And if the baby is pink in color, it is totally normal, that is 2. The score is 2. Okay. And P stands here for pulse rate. So if it is nil, the score is 0. If it is less than 100, it is 1. And it is more than 2. If it is more than 100, the score is 2. Okay. It is G. G for grimace, that is reflex with the catheter in the nostril. And if he has no response, it is scored as 0. And a type of grimace is present, it is scored as 1. And any cry or sneezing is present, it is scored as 2. Okay. And A here for activity of the baby. If it is, or the tone of the muscles. If it is flaccid, it is 0. And some flexion of the limb is present, it is scored as 1. And if it is in semi-flexed and the active movement is present, it is scored as 2. Okay. And the respiration, RI stands for respiration. If there is no respiration, it is scored as 0. And slow and irregular for 1. And if the crying, immediately after birth, if the baby is crying, it is totally normal. So it is scored as 2. And this is the scoring system. If that by totaling these all scores, and if it is total is given as in between 8 to 10, it is quite normal. The baby is normal. And if the score is in between 5 to 7, it is moderately asphyxiated. Okay. And if it is less than 4 or 3, it is severe distress is present. So we can infer the baby has some neurological problems or CP is present. Okay. Then moving to the another important point, that is colostrum. So what is colostrum? The first breast milk that is produced after giving birth is known as colostrum. Okay, we have studied this, and its color is lemon yellow in color. So it is secreted from the breast since the late 3rd trimester till the 4th day after birth. So the colostrum is secreted from 3rd trimester till the 4th day after birth. Okay. And what is the importance of this colostrum? The colostrum, which contains specific antibodies, and also IgG and PRP. PRP means protein-rich polypeptides are present, which fight against the allergies, and lactoferrins are present. It acts against some type of cancer, and it is antiviral. And antioxidants like vitamin A, D, C, E is present. And the cholesterol also contains the growth factors such as IGF, which means insulin-like growth factor, and epidermal growth factor, which stimulates the repair process at the site of inflammation, and the transforming growth factors, that is TGF, which stimulates the gastrointestinal growth and its repair, and it will inhibit the acid secretion, stimulate the mucosal secretion. So these much things are present in a colostrum. That is why the baby is recommended to take the colostrum immediately after birth. So it will increase the immunity of the baby. So in Ayurveda, which Acharya mentions the immediate stanapana after birth? Who mentions stanapana at the first day itself? Okay, good doctor. Charagajeta. Right. Then we are moving to the breast milk composition. So mainly the breast milk, in breast milk, the lactose is 7 gram. The main content, that is a 7 gram lactose is present, and the fat is 4.5 gram, and the protein is 1.1 gram, and it also contains whey proteins. That means a combination of lactalbumin and lactoferrin. That is known as whey protein. It is present the 80% of the breast milk. Okay, and the 30% of essential fatty acids are present, and the total calories 67 calories. And coming to the P bar S ratio, it is 1.2:1. What is P bar S ratio? It is a ratio between the polyunsaturated and saturated fatty acid. Okay. If the ratio is near to 1, that will reduce the risk of CAD. CAD means coronary artery disease. Okay. So mainly you have to remember the P bar S ratio and the lactose composition and the fat composition. Okay. These are important. Next is concept of breast milk banking. Nowadays, the breast milk banking is available as blood banking. It is recommended in case of if the baby's mother is died or the mother have any severe diseases, severe systemic diseases, and unable to feed the baby. In that case, the breast milk banking is helpful to the baby. Okay, so this is a service for collecting, screening, and processing, storing, and distributing the donated human milk. Okay, and the best method of collection of the breast milk is hand expression. Okay, it is known as the hand expression is known to be the best method of collection. Okay. Next, that is the dental caries. You know that in children, this is increasing in nowadays. They are very fond of chocolates or the food which is uh, mainly in sweet and other carbohydrate. Okay. So tooth initiated by the demineralization of the outer tooth surface due to the formation of organic acid during the bacterial fermentation of the dietary carbohydrates. Okay, the organism mainly present in the dental caries is Streptococcus mutans. What is the organism? Streptococcus mutans. And the incidence of this dental caries is directly proportional to increased intake of carbohydrate. Okay, and the clinical feature, you are well aware of that. Initially the white spots are present on the teeth and the loss of tooth tissue, and which is result in cavitation. And what is baby bottle tooth decay? baby bottle tooth decay. This means the extensive form of tooth decay with a mixing bottle. If the baby is with this bottle on his mouth, then he has a chance to develop tooth decay. So it is termed as baby bottle tooth decay, and the complications that produced this pain, infection, pulpitis, dental abscess, and several types of facial infection and a disruption of normal development of permanent teeth also. Okay, so maybe we have to give the information to the parents about the care, which starts from very beginning after. So in babies, clean the gum with a cotton pad. If tooth is not developed, the gum of the baby with the pad after breastfeed. Okay, and the mother's food is fortified with more minerals, and the brushing habit should be developed, which have to be done twice daily. Okay. Then we have the national programs related to the child health care. Mainly the RCH program. You may heard about this program. That is RCH programs, Reproductive Child Health Program. It's launched here 1997 to 1998 to improve the health status of women and children and reducing the infant and maternal mortality and morbidity. This is the aim of this program. Okay, both the health of mother and baby is taken care of in RCH program. And remember the launching year of the RCH program. And we are going to study the nutritional programs in India. The first one, ICDS program, that is Integrated Child Development Service Schemes, and which are given for the children under 6 years and the pregnant women's feeding mothers and women aged between 15 to 44 years are beneficiaries of this program, ICDS program. Okay. And next is midday meal program. This is mainly aimed for the children attending the primary schools. And another program, that is the special nutrition program, is also the children's in the pre-KG preschool section. That means 3 to 5 years. And also the National Nutritional Anemia Prophylaxis Program. Here it also means to the caring of pregnant and nursing of this mother and children between 1 to 5 years. Okay. So you have to remember the names of this program. Okay. And next, that is, you have to study the red flag signs in the development. So in second month, if we have no visual fixation, it is a red flag sign in the development of the baby. We have studied in second month, the baby developed the social smells. Okay. So if he have no activities like this, it is a red flag sign. And in 6 months, if he have no vocalization, if he not say any monosyllables or something, it is the red flag sign. You should consult a pediatrician immediately. Then in 9 to 10 months, if the baby is not sitting without the support, it's also an emergency sign. And in 16th month, if he is not standing alone, and in 18th month, he is not walking alone, and after 3 years, he is lacking of imaginating play. These are the red flag signs of the development or to achieve the milestones of the baby. Okay. Then another important part, that is the reflexes. The first reflex that you have to remember is the tonic neck reflex. What is that? A normal response in newborns, which is characterized by extension of the arm and leg on one side of the body, to which the head is quickly turned, while the infant is supine, and to flex the limb of opposite. Okay. And abnormal persist indicate the spastic cerebral palsy. This makes the baby locked in fences position. And in case of Babinski sign, maybe persists up to 2 years till the myelination is complete. And the Babinski sign indicates hemiplegia. Okay. And next, that is Moro's reflex. It has 3 phases. And the Moro's reflex is persists for 3 months. At birth to 3 months, the Moro's reflex is present. Okay. And the parachute reflex is persists throughout the life. From 9 months to throughout the life, the parachute reflex is present. And from birth to 2 years, the Babinski reflex is present that we have discussed now. What is the Babinski reflex? The Babinski reflex occurs after the sole of the foot has been firmly stroked. Okay. And the big toe is then moved upwards, and the top surface of the foot and other toes are far out. Okay. This is a Babinski sign. It's very important, and it is present up to 2 years. Next is gag reflex. That will never disappear. So the gag reflex is the contraction of the back of the throat triggered by of your tongue and the area around your tonsils, and it helps to prevent in choking. That is the function of this gag reflex. It prevents the choking. And the other reflex, which is also persists throughout the life, is coughing reflex. If any foreign particles stimulate the airway, the coughing is present. And the other one is sneezing reflex. And next is a swallow reflex. These are the reflex which never disappear in the life. And coming to the sucking reflex, which is very important, it is present up to 1 year. While rooting helps the baby to become ready to suck. While we are touching the roof of the baby's mouth, he will begin to suck. Okay, this is a sucking reflex. And in case of rooting reflex, which is present from 3 to 4 months only. So it is seen in normal babies. The baby turn the face towards the stimulus and make sucking, that is rooting motion with the mouth when the cheek or the lip is touched. If we touch with the angle of the lip, he turns towards his face. Okay, that is known as rooting reflex. So the sucking reflex, rooting reflex, parachute reflex, and Babinski reflex, Moro's reflex. These are very important. Okay. And we have discussed the APGAR score. Coming to the umbilical cord. Then we have discussed the clamping of the umbilical cord, Nabi Nali Chedana. Okay, so the cord cut at the 2 to 3 centimeter from the umbilical base. Okay, and the umbilical cord contains mainly 2 artery and 1 vein. It's very important. It mainly contains 2 artery and 1 vein. And this artery, what is the peculiarity of this umbilical artery? This umbilical artery is mainly contain deoxygenated blood, and the umbilical vein contain oxygenated blood. Okay, remember this. And mainly 2 artery and 1 vein. And the cord is useful for preservation of the stem cells. Okay, and the cord care that was done by triple dye, which was considered as the most bactericidal agent. But nowadays, no local application is advised. Then it will require 10 to 14 days for the falling of the umbilical cord. Okay. So remember the number of days required to the falling of the umbilical cord, and it contains 2 artery and 1 vein, and the specificity of this artery and the vein present in the umbilical cord. And according to WHO, nowadays the WHO suggests the cutting of umbilical cord is not done immediately after birth, because they explain that this umbilical cord that contains a lot of iron content blood. So while clamping the umbilical cord, uh, it requires 1 minute delay, so that much iron content blood is transported to the baby's body. Okay, so that will increase the immunity of the baby. So that's the reason for delaying of the clamping of the umbilical cord. So immediate clamping is required in case of emergency conditions only. So in olden days, immediate clamping was done. So now the immediate clamping is required in case of if the mother or baby have any emergency condition. Otherwise, it requires 1 minute delay is required. Okay. Then here you can see the child weight gain. So after birth, the baby loses his weight within 7 to 10 days. He lost weight because he had to adjust with the external environment. So he will lose the weight at the birth. After for 1 week, he lost the birth. Okay. Then he regains the weight that is 30 gram per day in first 3 months. So in first 3 months, he gains the weight in 30 gram per day. Okay. In second month, it is 25 gram per day. And in last 3 months, it is 15 gram per day. Okay. This is the order of gaining of weight of the baby. Just remember, he loses weight in 7 to 10 days. Thereafter, in first month, he acquires 30 gram per day. Okay. Next, just remember the normal weight of the newborn. It is mainly 2.5 to 3.5 kg. It's the normal birth weight of the baby. Okay. If the baby is less than 2.5 kilogram, he is having low birth weight. Okay. And it is prone to different type of diseases. And the height of the or the length of the baby at the time of birth is 50 centimeter. And the umbilical cord length is also 50 centimeter. And the head circumference is from 34 to 35 centimeter. And the chest circumference is 31 centimeter. Then the pulse rate at the time of birth is 140 per minute, whereas the respiratory rate is 28 per minute. And the blood pressure is 60 bar 40 and 80 bar 50. And in case of preterm baby, the baby is termed as preterm if the birth is occur less than 37 weeks. Okay. And the newborn requires 100 calorie per kilogram body weight. This is the amount of energy a newborn requires. Remember the weight, normal weight, and the umbilical cord length and the height of the baby at the time of birth, and also the pulse rate and respiratory rate, and who is termed as preterm baby. So these are points very important. Okay. Then coming to the nutrition, the vitamin K. It is the newborn of breastfeeding prevent hematological diseases. So the vitamin K is given for the baby to prevent the hematological disease. And vitamin E is given the weight of 1.5 gram at the birth. And in case of vitamin C, all artificially feed infants. Okay. These are not much important. And next is PEM, that is protein energy malnutrition. It's very important question. Okay. Then mainly the protein energy malnutrition can be divided into two, that is marasmus and kashyapa. And the features are very, very important. You have to study it. In case of marasmus, mainly the carbohydrate deficiency is present, and the face of the baby is like monkey. Okay, and the age of the baby at the time is mainly in between 6 to 24 months, and edema is absent, and it is considered to be an adaptation syndrome. Okay, so in marasmus here, carbohydrate is deficient mainly, and baby acquire monkey face. Okay, and the mental features include the alert and irritable. The hair texture is modified here, and there is no specific in signs present here, and the appetite is present in this case, and here the severe anemia is a mainly here the patient have severe anemia. Okay, these are the features of marasmus. And in case of kashyapa, the protein deficiency is present with the moon face. The baby have moon face, and with the age of 12 to 30 months, mainly the symptom is edema. In case of kwashiorkor, the symptom is edema, and it is a disadaptation syndrome. And the baby have lethargic, fatigue, and the hair is easily pluckable. And the main sign, that is flag sign, is present in case of kwashiorkor. And appetite of the baby is very poor with the clubbing of finger is present. So you can remember the marasmus symptom as M, the monkey face. Mera mangi, mera means marasmus. Okay, and face of the baby is like monkey, and the red the sign, the flag sign is very important. It is always asking, okay, which is the sign in kwashiorkor? It is flag sign. Flag sign. Okay. Coming to the rickets, it is mainly produced due to the deficiency of vitamin D. Here you have to remember the Harrison's groove and craniotabs, a soft skull. So these are the main features of this rickets. And rickets rosary is also important. That is, the costochondral swelling can be present. Then the next is hydrocephalus. The clinical feature is enlarged head size. Okay. And the main thing you have to remember here is sunset sign. In hydrocephalus, which is the sign? Sunset sign. And which means the sclera is above the cornea. And also, in case of congenital hydrocephalus, it is associated with rubella, cytomegalovirus, and toxoplasmosis and intracranial bleeds. Okay. So in hydrocephalus, the sunset sign is present. That means the sclera above the cornea. And next, that is poliomyelitis. It is mainly of three types, type 1, 2, and 3. The main transmission of poliomyelitis is through fecal-oral transmission. Underline that point. Fecal-oral transmission is the route of transmission for poliomyelitis. Okay. Then the clinical features are explained here. You can just read that points. Okay. And the kerning sign is positive in case of poliomyelitis also. That is neck rigidity. So kerning sign is mainly seen in meningitis. And in case of poliomyelitis, polioencephalitis, the kerning sign or the neck rigidity is present. Okay, so the baby is present with this kerning sign, and dysphagia and choking and lockjaw are present. Okay. So you have to remember this sign. turning sign, sunset sign, flag sign. Okay, so please write these codes into another notebook and read it again and again. Okay, then coming to the chromosomal disorders, this is also very important. Mark this as 3-star important. The trisomy means addition of extra chromosome. That is, a sex chromatin or bar bodies represents genetically inactive X chromosome. So you have already studied these chromosomal disorders. The trisomy 21 is known as Down syndrome. Very important. Trisomy 21 is Down syndrome. And trisomy 18 is known as Edwards syndrome. And trisomy 13 is patau syndrome. So these are very important. And in case of Turner syndrome, that is 45 plus X0, there is no bar bodies. And triple X, that is super females having 2 bar bodies. And in case of Klinefelter syndrome, here also XSY, 47 plus XSY. And here also 1 bar body is present. Okay. So mainly study this trisomy 21 in Down syndrome and trisomy 18 Edwards syndrome, trisomy 13 patau syndrome. Okay, and also Turner syndrome, Klinefelter syndrome. So the features of Down syndrome is mainly mental retardation is present, and a flat face is the salient features of the babies with the Down syndrome. And the brush field spots, mark that one. Brush field spots on iris is present only in Down syndrome. Okay. And in case of Edwards syndrome features, it is present in 1 in 4,000 child, and hypertonia is present with a shield chest. Chest is like shield, and the babies survive up to 3 months. That is known as Edwards syndrome. And in case of patau syndrome, the feature is cataract and cleft lip and palate. Very important. Cleft lip and palate is present in patau syndrome. And in case of Turner syndrome, the baby is having web neck and shield chest is also present. So in Edwards syndrome and in Turner syndrome, the shield chest is present. And in Turner syndrome, mainly they have the feature of short stature in nature. Okay, they are short stature with widely spaced nipples. Okay. Okay, now we can wind up this class. So the next day, that is tomorrow, we will continue this modern portions. And if you have get the time, we will start the next subject, that is in Panchakarma. Okay, so get ready to study the next subject. So we are going to completing the Kaumarabhritya along with its modern portions. Okay. Then again, if you have any doubt, you can ask me at any time, or you can drop any message. Then, so start to study if you are not started the studying yet. Okay. So the yesterday, the result of 2024 entrance examination has arrived, isn't it? So in the next year, it is your turn. So study with a relaxed mode. Okay, enjoy while studying. So there may be some up and downs during studying. You may get bored or something will happen during your studies. So don't get panic or worry. Okay, so these all are the part of studying, and just you have to remember that the consistent study with the codes, and also remember these weekly subject and weekly examination. Try to attend the weekly examination, and also the speed of the examination is also important. So you have to practice daily. Okay. So we are going to wind up this class. Okay. Thank you. Thanks for listening. Good night.